First, I would like to ask for your both permission to use this video for educational purpose and on internet.
Yes.
Thank you. This is a follow-up testimonial or interview about the surgery that we did about 5 months ago. Can you first yourself and then maybe you discuss with me what were your symptoms before the surgery? Can you?
It was so bad to where I could hardly walk, to the point where I was crawling. It felt like it. But then there was times if you stubbed my toe, it felt like someone tore my leg off.
1 to 10, how bad was your pain?
Oh, it was above the scale.
Off the scale, yeah. And you don't have a regular job. You have a demanding job.
Yes.
What do you do?
I'm a farmer.
Okay, so they day in, day out on the field, using different heavy machine and so on.
Yep.
What did you notice about his job, his work, his life?
Well, you mean before the accident or
Before
after?
the surgery?
Before the surgery, it was complaining all the time, and he was hurting. He was very worn out,
Mm-hmm.
almost unbearable to live with sometimes.
Yeah.
because
that is all,
No.
unfortunately, is sometimes, you
the
know.
pain made it so unbearable that
Yeah.
that our children even just kind of avoided him sometimes. Because he was
Oh,
just,
yeah, that changed lives.
Yeah.
That changed lives. Now, the surgery was just about 5 months ago.
hmm
Now, how long did you stay in the hospital?
I stayed in the hospital 2 nights.
2 nighs. And, you know, we did a 2-level fusion. And I'm going to turn here. We noticed after significant diagnostic that the second and the third disc from below were truly damaged, and that was what's causing your problem. And then we fixed that in the surgery that I have the documentation about. Didn't really take long. Yes, you stayed 2 nights in the hospital, but usually after open surgery, people stay much longer. Our surgery time was actually 58 minutes, and our blood loss was only 26 cc, which is less than an ounce, which is
Wow.
very little. Now, when you went home, after how long were you able to do your basic daily activities?
Month and a
Yeah,
half.
that's-
Within 4 weeks,
Yeah, within 4 weeks. How long after the surgery were you still on pain medication?
I went off after 2 weeks.
2 weeks? That's fantastic. And you know, your job, again, is an extremely demanding job by any standard. You said you went back to work how many months
In the
after?
1st of July, I started mowing hay with the tractor,
So
and
about 2.5 months after the surgery, right? That is unheard of after open surgery. Somebody going to that kind of work after the open fusion, that would be unheard of. But you told me that you sometimes noticed that when it's something too much. Can you describe that to me again?
when I was on the tractor seat for a while mowing hay, I could tell that it was, when I got off, I was tired.
Mm-hmm.
And so
But
maybe
no pain, just tired.
just tired.
Okay.
The pain wasn't there.
So the pain that you had in before the surgery was practically gone?
Oh, pain I had before the surgery, there was none.
Good, excellent, excellent. When did that pain go away that you had before the surgery?
Oh, I'd say the knee pain at the hospital, as soon as I had my surgery, when I stood up to go to the bathroom the first time, the knee pain was gone.
So the leg pain was gone right after the surgery.
The
And
main knee pain, yeah. And
The
then,
radiculopathy, we call it radiculopathy. You had the L4 and L5 radiculopathy, and that was gone right after the surgery.
yep. And so then there was muscle pain in my legs after that. So it was hard to get up and down on the tractor and maybe to sit on a seat, but about an hour on the tractor, I had to slow down, but that's all I wanted.
And you said you even noticed that there's a certain speed.
Yeah, I had to slow the tractor down
Yeah.
enough so that it wasn't a high vibration too long.
Okay. And otherwise, you know, from your observation, from where he was before the surgery and where he is now, we are just about 5 months, barely 5 months after the surgery. Where is he? And, you know,
I see him doing a lot more today
yeah.
than I used to. Just yesterday, I think I was asking my girls, have they noticed that he isn't complaining as much
yeah,
anymore?
yeah.
And they both said, yeah, we were just thinking the same thing. So this
Now you
past week especially, he's
Yeah. You told me before the surgery, obviously pain make us that way. He was unbearable. Is he more bearable now?
oh yeah, yeah.
You know, when we have all our problems and on top of that you put this kind of
Pain, yeah.
horrible pain, that sort of destroys all kind of normal relationship in our
Exactly.
environment.
Our neighbors have said that, Beck, I can't believe it, you actually have a smile again.
Oh, that is
Yeah,
nice.
yeah.
No, but you told me as well, you know, something happened to your mower and you were overdoing it and then you noticed something. Tell me, what happened to your mower? You said
Oh,
it wasn't.
I was working on the mower with a welder,
Uh-huh.
and it caught on fire.
Okay.
And we tried to get it out with water and
Yeah.
fire extinguishers, and so I went to go to my Bobcat, which was maybe 50, 60 feet away, and I actually ran to it. And while I was going, all of a sudden I realized I'm not supposed to run, but it doesn't hurt.
Okay.
So, but then I was scared, but I went and talked to my therapist, and he said, well, does it hurt? And I said,
Yeah.
no, it doesn't hurt.
Yeah.
Well, you probably are okay then.
Yeah, and you are. You know, our body, pain is a signal that something is wrong. And you know, we want you to obviously slowly go up on the level of your activity, but we just looked at the films. Your bone actually start to grow. We are very happy with that. And I think even with your demanding job, and that is the point, that even with your demanding job, we achieved the results, and you're already long back to your demanding work. We are really far ahead of that open surgery could ever be.
Mm-hmm.
Doesn't mean we should avoid the common sense, and if you jump off the barn, you're going to not feel good. But I think as long as you listen to your common sense and to your body's language, which is being tired,
Mm-hmm.
which means you're at the border of doing too much, or being in pain, meaning you already did too much. I think as long as you listen to that, we are going to be fine. Okay? Thank you so much for the interview.